As they said, I'm the National Coordinator for the Highly Rural Transportation Grants Program. You can go to the next slide. The Highly Rural Transportation Grants Program was born out of Public Law 111-163, which is the Caregivers Bill. Essentially, this bill allowed VA to stand up a new grants program. This new grants program started actually the bill was authorized in 2009 and signed in 2010, and we stood up the program in 2013. Next slide. This program actually authorizes VA to provide transportation grants to veteran service organizations or state veteran service agencies. These agencies will provide innovative approaches to transportation. They will also focus on highly rural areas, which I'll define later. They will increase access to transportation to those veterans who live in highly rural areas. They will improve community linkages and relations and adhere to all the federal rules, laws, and Office of Management and Budget regulations. And this all is to enhance veterans transportation coordination. Next slide. Again, the eligible entities for this program that's in the federal statute of Public Law 111-163 are veteran service organizations and state veteran service agencies. Those are the specific agencies that can only apply to the grant whenever there's a notice of funding available. In one caveat to those specific organizations, those eligible entities, the organizations have to be recognized by the Secretary for Veterans Affairs. And if you'll see on the slide that there's a section under Section 5902 of Title 38, you can actually Google that and you'll find that Section 5902 Title 38, which actually shows how a program can be recognized by the Secretary for Veterans Affairs. Next slide. Highly rural is defined as less than 7 persons per square mile in the county. I know a lot of folks always ask, well, we're very rural, but this is based on the population density. And if you can look at the map, most of the eligible entities are on the West Coast, Midwest to West Coast. So there are 25 states that are eligible. And on the next slide, you'll see those states, 25 states. Under this program, next slide, please. Under this program, VA funded $3 million each year for the program. The maximum allowable grant size is $50,000 per highly rural area. And that means that we consider a highly rural area as a county having less than 7 people per square mile, and that's based on the population density. So each county that an applicant can apply for, they can apply for more than one county. So an applicant can apply for 2 counties and possibly get up to $100,000 for those 2 counties. So it's not $50,000 per year, it's $50,000 per highly rural area. The grant program actually publishes the notice of funding availability on grants.gov. All federal grants are posted on grants.gov, and that's the only way an entity can apply. So once a NOFA, or a Notice of Funding Availability, is posted on grants.gov, an applicant can go on grants.gov and look at the specific grant application instructions. Also on grants.gov, it would actually list the date, time, and place of submitting completed grant applications. At this time, we're not taking applications, but whenever we do show a notice of funding availability, it will be listed on the grants.gov website. So not calling or emailing to find out when we're going to post, it's always posted on grants.gov. Also on grants.gov, it will show a list of counties that are highly rural, so you won't have a question about what counties are eligible. In the notice of funding announcement on grants.gov, it will actually have a list of counties. So it would also explain the explain the things that you need to know to apply for the grant. It would also have scoring and selection criteria of the grant. It would also talk about the length and term of the grant award. The grant awards are for 1 year, and so at each year the grants are, the applicants or the grantees have to apply for a renewal grant. So the grants are for 1 solid year, and each year grantees will have to apply for a renewal grant. We just completed our renewal grant scoring of this current year, and we'll be notifying the grant recipients of those who were awarded the renewal grants. Next slide. We currently have 14 grantees, and almost all of the $3 million that's allocated for the program goes to all 14 of the grantees. So some may ask the question why is there not a new notice of funding that's published every year? That's because we're only authorized $3 million. So the 14 grantees that we have take up about all of those $3 million. And if you can see the fiscal year 15 grantees, we have 4 American Legions, 4 Veterans of Foreign Wars, 6 State Departments of Veterans Affairs, and they're all in Alaska, California, Idaho, Maine, Montana, Oregon, Nevada, North Dakota, South Dakota, Texas, and Washington State. As I said, the fiscal year 16 notice of funding was posted for the current grantees only. That posting expired, and those grantees applied for that amount of funding. If you'll note, at the bottom of that slide, it says there's a small possibility that will be a new NOFA coming out with $500,000 to $800,000 in available funds. Those funds were swept and going back to the U.S. Treasury. So there may be additional additional monies for new notes of funding coming out sometime in the first or second quarter. We usually only put out a grant renewal NOFA in the fourth quarter, which is around the same time frame. So the grantees that are currently in the program really get first dibs because they're already in the program. If any funding left over, then we may possibly put out a new notice of funding. Next slide. On the next slide, I'll show you the accomplishments that we've done for 2015 for quarters 1 through 4. And if you can see, and this is what 14 grantees operating in all those states. And you'll see the time it takes to pick up and drop off veterans. So that's the driver time when they leave their station to pick up a veteran and take them to VA or non-VA care. The grant is specifically to transport veterans to VA or non-VA care. And when I say non-VA care, that's VA community care or that VA authorizes. So sometimes VA authorizes care in the community, and so transportation to care in the community or to VA are the only authorized transportation sources. And if you can see the number of trips that were completed in fiscal year 15, over 25,000. And you can see the distance in miles in over 8,000 veterans served during fiscal year 15. And, you know, we always look at satisfaction rate. We maintain a 96% satisfaction rate over the total of the fiscal year 15 for quarters 1 through 4. Next slide, please. If you would like more information on the grant program, you can contact me, Darren Wallace. There is my number. You can also send information to the email hrtg@va.gov. That goes to a group of us, but I'm the primary person who actually will answer that. There's also a link to the HRTG. The HRTG is Highway Road Transportation Grants. There's a link to the final rule. Many people have questions. The final rule actually has a lot of the question and answer information that is published from the final rule. So if you'll take a look at the final rule, which has all of questions that were asked when it went out for public comment, that's a good document to look at. And then there's also a link to the website. If you look at the website, you'll find out more information about the program. You'll also see how veterans can access the program. It has the actual organization, the name and number of the organization where a veteran can call to be transported. And it's only in those available counties that's on the website. So although there's 25 states eligible, it's only on those approved counties that are on the actual website. And you'll see those numbers on there. And if you have any other questions at the end of the presentation, I'll be glad to answer. Thank you.
Great. Thank you, Darren. Again, if you're looking for the contact information, the slides can be downloaded in the handout section, and they'll be available on our website afterward. Our next speaker is Dave Cooley, a program analyst for statewide veteran services with the Oregon Department of Veterans Affairs. Dave?
Thank you. Greetings from Oregon. It's a beautiful day, about 75 degrees and sunshine. So welcome to this presentation today. Next slide, please. Let's examine our veterans landscape. We have population density numbers here, and almost all of the highly populated areas are on the eastern side of the state and some central, and all of the highly rural, western side, and all the highly rural are eastern. So of the 17 extremely rural counties we have, 10 of our counties are actually eligible for this grant program. Next slide, please. When we take a look here at our history and our program, we've been at this. This is our third year, and you can see, if you will read top to bottom in the first category there in column, 2014, the number of counties we had participating. Beginning in August, a month later, we added 2 more. So we started initially with 6 and added 2. And in this last year, the final column, you'll see that we actually increased beginning September 15th. With this grant year, we added 2 more counties to ensure that all of the rural counties we have that are eligible can participate. Next slide, please. We are the grantee, and so in this structure that Darren has for us, the counties are our sub-grantees, and we can see the division. The counties that deliver transportation services through county government agencies and their employees, and there are some special transportation districts, but they're still overarching in government. They have government that is managing their programs. Some of our counties are delivering transportation services through private nonprofit transit districts. So part of our challenges here when we initially began were making sure that we were all using the same language and participating in the process together. As a grant coordinator, we just don't provide the oversight here. I also travel and work with each individual county based upon what they need. And what's been terrific is many of our counties are so experienced, they were actually doing the teaching and helping us understand how to manage a grant of this magnitude. We do conduct on-site training visits as needed, and we also make an annual visit and conduct an audit for each county. We initially brought everyone together on telephone conference calls and asked everyone to mail in their information, and then we turned around and did a return mail to include everyone so that folks could see what their neighbors were using to manage their programs with. We then added a one-day conference so that we could get together, everybody in the same room. And what the beautiful part about this is that we simply put the program together, and all the participants really run the thing themselves because they're the ones who are delivering the services to different counties and their different structures. I want to make mention here as we take a look at how we get business done. We're fortunate because as a state organization, we have all of the infrastructure that we need. So we have a complete fiscal department, we have a chief financial officer, we have a comptroller, and we have a budget officer. And so they help us with the processing of the requests and the payments and so forth and so on. And on the ground, the true partnerships now are the local county veteran service officers. So that doesn't just mean county veteran service officers. It also means all of the veteran service organizations that also partner with local services. So we have asked our counties here to accept the responsibility to verify eligibility and ridership for people in this program. And so each one of these transportation districts or delivery systems partners with the local county veteran service office to make sure that we can get a really quick decision to find out who's eligible to ride. So that gets done. So the VSO partnerships also include the county veteran service officers can then provide other assistance as necessary as they make contact with the riders. And that's excellent for plugging our veterans into other state and federal benefits that they may be eligible for. Next slide, please. So here are our totals reported through the first 9 months of this year, and we saw the totals there that Darren had for the entire program. So you can take a look and see a couple 100,000 miles driven in the first 9 months of this year. Nearly 800 veterans have been served. And we pick veterans up at their homes. We travel not only to the different medical centers that are served here, but we also take folks to local clinics. A lot of these transit districts will actually call the doctor's office. So if a veteran calls in and says, I need a ride next Tuesday, they'll call the local doctor's office to verify the time and so forth and so on. So the coordination takes place, and it makes delivery of systems very effective. So the veterans are being picked up at their homes and returned to their homes as are needed. All right. And that will be my last slide. Thank you very much. I'm available at the end of the presentation for questions.
Great. Thank you so much, Dave. Our next speaker is going to be Joni Bramlett, the Regional Transportation Coordinator for Rail and Public Transit Division. Again, Oregon Department of Transportation. Joni?
Hi, thanks for having me at this presentation. In Oregon, we always tend to be out there first doing pilots and doing new things. So before the Highly Rural Grant Program got started, we were funded by our legislature, and I'm going to give you a little bit of context first. So next slide, please. As Dave indicated, Oregon is primarily a rural state with the majority of the population on the west side of the state in the Willamette Valley. But on the east side and a couple in southwestern Oregon have very rural areas, and some of our counties only have 1 to 2 people per square mile. As of the 9/30/2014 statistics on the census, Oregon had a little over 330,000 veterans, and they represent 8% of Oregon's total population. Like everyone else, though, they're spread out clear across the state, so it's really a challenge to serve people in the highly rural areas of our state. Next slide, please. And veterans, as you know, need their medical appointments at the VA hospitals and centers, and they're also spread around and create quite a distance for people to have to go. And when you're coming from someplace like Wheeler County or even farther east, to get to the Portland VA hospital can be a 12 to 16 hour day for the driver and the veterans. Next slide, please. This map shows our inner city bus service, which typically does not serve people who are elderly, frail, or people with disabilities very well, because, you know, you get on the bus and you go where it goes and you get off when dumps you there, and then you're on your own. So our veterans and other older adults and people with disabilities tend to need a little bit more care and service when they travel. I want to point out that in Oregon, every single county is served by transit, but many services are local and do not connect with the regional networks. Next slide, please. Now I'll get into the actual pilot that the Legislative Task Force was created by the Governor's Office and asked to look into veterans transportation specifically, and that happened in 2009. And a report was issued in 2010. At the end of my slide presentations, there is a link to this document, and if you're interested in reading about what generated this pilot, feel free to pick it up off of the website and read it. The major findings were that transportation is a major barrier to the veterans being reintegrated once they get back from service, and the task force report recommended that our agencies, the veterans organizations, public transit, ODOT, all need to do more to provide education and information to veterans so that they can access the existing systems. So in this pilot, 12 counties were served. They were selected by the Oregon Department of Veterans Affairs. The first rides were provided in February of 2013. One of the 3 pilots took a little bit longer to start. I think their first ride was in June of that year. And the pilot just ended June 30th of this year. Next slide, please. So what Oregon DOT did with the report recommendations, we worked with the veterans organizations to find vehicles that were being surplused by transit agencies. We paid to have them refurbished and donated those vehicles to the veterans organizations that provided transportation. And that didn't work out too well, because if you're in the business of transit, you know that when transit agencies dispose of a vehicle, it's either something that didn't work out for their service area or they used it up. So one of the vehicles actually broke down on the way as they were taking it to deliver it. So we learned a lot from that. We provided driver training with a ride connection out of Portland. They agreed to provide training to any of the veterans organizations that had drivers that were taking on these vehicles with the ADA equipment so that they could access it and use it properly. Even though the vehicle transfer wasn't the optimum thing to do, I spoke to a gentleman at the VA center, and he said that they learned so much and it got a lot of people over the hump of not feeling comfortable with the ADA and lift and ramp equipment that transit folks are using on a daily basis. So we also conducted the 3 pilots I alluded to earlier, and I'll go into those in a little bit more detail here in a minute. And then we also have been educating legislators about the need for additional funds, and I think the Highly Rural Transportation Grant Program is really helping show what a little bit of money can do across our state. So I think I said already that in total 12 of Oregon's 36 counties were included in the pilot, and that ODVA actually selected the areas. So we had one in Central Oregon covering 3 counties, one in Southern Oregon covering 7 counties, one of which was Lake, which was also being served this year with the Highly Rural Veterans Grant. It was the only county that was eligible in both these pilot and the highly rural program. And then in central Willamette Valley, we had another 2 counties. So in the beginning, the legislature provided $100,000 set aside from state funds for transportation to initiate these 3 pilots. So each pilot got $33,333 for a 2-year period. And then in the 2005 legislative session, they added another $100,000. So each pilot got $66,666. And then the state ODOT decided we wanted more information. We wanted the data to continue, and we recognized how it took a little while to get started. You know, when you're providing outreach and education, it takes a while for people to get in the system, and many of you may know that it takes a while for veterans to even get their medical appointments initiated and get ready for that ride. So we added an additional $45,000 and extended the awards for another year. Next slide, please. This is just a photo of one of the refurbished vehicles that we actually sent to a transit agency to provide more veterans rides, and that's the typical type of vehicle that we provided. Next slide, please. So the purpose of the pilot was to provide medical trips really similar to the highly rural grants. But we wanted these rides to be the last resort when no other options or an ADA accessible vehicle was needed, and any veteran with a medical card was eligible from the transit perspective. And we coordinated the trips with the veterans organizations. A lot of our rides, especially in Central Oregon, were provided either to the local VA clinics or to link up to the DAV rides to the Portland or other distance medical facilities. So we saw that the shorter trips and more rides were provided in Central Oregon because of that linking up with the DAV outside of the hours and areas that transit normally goes. So these funds were really, really important to get veterans rides to their medical appointments. And a big component was to also provide the planning and training to veterans, get them used to riding transit. So once a veteran knew about transit and how to ride it, and if they could afford the fare, they probably accessed it for local trips, you know, more than they might have before because they didn't know about the opportunities that public transit has in our counties across the state. Next slide, please. So we had several performance measures like, you know, the number of rides, unique individuals served, and cost per ride, and those statistics were provided by quarter. In the next slide, I have a little caveat to share with you about those rides in miles and people served. Also, we wanted to know how many trips each veteran needs, what their travel patterns were, you know, how many were local and how many had to go to Portland or some of the other facilities you saw on one of those maps. And then, is there a different cost for a rural area versus a more urbanized area? And what the results were there cost savings, were more veterans provided rides because of the pilot? And we're still working on our final report, and I'll get to that a little bit more, but I want you to know that there's more information coming. Next slide, please. So by the end of the pilot, we just got in the statistics, so we still have some reconnoitering to do to make sure that the numbers are accurately depicting what happened. But during the quarters, this is what the final report came out. 3,933 rides, 931 individuals served at about $74 per ride, for a cost, and then the total funds spent. There was no match in our program because our state funds do not require a match. But what we found out from the final reports was that there were 470 unduplicated veterans served. So, like I said, we're still working on our final statistics and numbers to find out why that was different. We think it's because as they reported statistics to ODOT for their payments, that they were truly having more unduplicated trips by quarter, but they were accumulating somehow instead of being distinctive. So our final report will have the actual numbers there. Next slide, please. So through the pilot, of course, we had lessons learned. We found that we really had a great deal of success when the local Veteran Services officers helped with the medical VA people to coordinate and collaborate with the transit agencies on the rides. Sometimes the DAV volunteer would cancel at the last minute, so because of our pilot, those veterans were able to still get their ride most of the time, and it really helped because otherwise they would have either just not had their medical appointment or they would have had to wait several months sometimes to get rescheduled. So it was really a lifesaver for some folks. The pilot meant that more trips were available when the local resources weren't available or appropriate in some instances. Because the DAV does not have ADA accessible vehicles, the only option they had was to access public transit. And like I said, we've had transit agencies provide rides to veterans across the state all along, but this allows us to provide more access. And they need more than medical trips. They need to go shopping, they need to pick up prescriptions. A lot of veterans need a family member with them when they're going through a medical treatment to help make decisions and offer support. So with transit agencies providing rides in their system that's already set up, we can accommodate some of these other needs, you know, where the pilot or the VA program would pay for the veterans ride, we could provide the opportunity for others to ride along with them. Next slide. So our next steps are to continue to communicate what the pilot did with our Oregon legislature, and as I said, the final report will be coming out soon, and I'm expecting that we'll post it to our website and I can provide a PDF version to anyone who wants it. I think that we'll come out with that in a couple of weeks at the longest. It's in review right now and being edited, so we're really close to having a final report. We will continue to work with other partners, especially the VA and Oregon ODVA and the highly rural grant recipients, as well as the governor's office, you know, transit agencies and local governments. And we have an advisory committee for public transit statewide, and we're still working on filling the veterans vacancy. We've had a veterans rep on there at different times. It's hard to keep them on our advisory committee, but we do our best. We want to support a statewide program and evaluate and research how we can restart, expand, and make more veterans transportation available statewide.
Great. Thank you so much, Joni.
You bet. Thank you.
You're welcome. Our next speaker, and I know that we have a lot of information today, so I thank our audience for kind of absorbing everything. The recording will be available, so we'll be able to go back through each speaker individually once the recording is posted online. Our next speaker is Angie Jones. She's a transit manager for Grant County Transportation District, John Day, Oregon. Angie?
Hi, thank you for having me. Well, I would like to just start out by saying that I am very thankful to this highly rural transportation grant that we received, because it's allowed us to expand our services and serve our veterans better, which is a wonderful thing. So our county, or Grant County, is 4,500 square miles. So we are pretty spread out. We travel, we have out-of-town routes 5 days a week. So we put on a lot of miles to our vehicles. But we connect 20 towns or cities in Oregon, in Eastern Oregon, which is pretty amazing. We connect through 7 counties. We're pretty busy. So when we got this grant, we were not connected south or north. We were connected west. So we were able to set up routes that go down into the city of Burns. There's a small VA clinic there. So we were able to set up a route that goes there, and then we were able to set up a route that goes north into Walla Walla, Washington, and we're able to stop in all of the towns along the way, including Pendleton. So the veterans who use this program, they don't have to be going to the VA facility. They can go to any doctor's appointment that they want, or a pharmacy. It doesn't matter, which is really nice. So like I said, this money allowed us to start those 2 routes to be able to better serve the northern area of our county and the southern area of our county and connect communities, which has been fantastic. So one challenge that we ran into in setting up these routes to the north was we pass through or stop in Umatilla County. We stop in a little town called Ukiah. And that is in a rural area of Umatilla County, although Umatilla is not considered highly rural. But it is not served by public transit. So when we stopped there, the residents were really excited. And there are several veterans that rode with us, but when they found out that Grant County veterans ride for free to medical appointments, they got rather upset because they were being charged a fare. So fortunately for them, one of their residents was pretty vocal, and he got on the phone with county commissioners and all kinds of folks, and he was able to get the Umatilla County to provide special transportation funds to Grant County to pay for the bus pass for those Ukiah residents. So that worked out very well for them, and now any of the Ukiah residents that ride with us, they're riding for free. So not just veterans, but all of the residents, which is pretty nice. So we recently had a lot of requests to go into Baker City, which is a town, if you go to the next slide, please, which is a town northeast of us a little bit. Next slide, please. You'll see on the map, we cover a large distance. So we recently had the opportunity to go into Baker City. And we're stopping in a little town called Sumter that is in Baker City. Now Baker City, also Baker County, receives the Highly Rural Transportation Grant. So we're able to work with them directly. I'm able to work with their transportation coordinator directly to get bus passes for those Sumter veterans that are riding with us on into Baker City for medical appointments, which is great. So I wanted to share with you just a quick story about how lack of funding can impact our veterans out here in the sticks. I have a gentleman that rides with us a lot. He's a U.S. Marine Corps veteran. He served in the South Pacific. About 2 weeks ago, this gentleman had to go into Portland to have part of his foot amputated. And we unfortunately are not able to travel into Portland due to funding. It's a limited amount of money. We just can't do it. So he chose to have his surgery at Oregon Health and Sciences University and not at the Portland VA clinic, which sits on the Oregon Health and Sciences University campus. They're separated by a sky bridge of maybe 50 feet. So he elected to have his surgery at OHSU. When he contacted the VA hospital to get transportation from Portland into Bend so he could connect with our bus, he was told no. He was denied that trip because he didn't have the surgery at the VA hospital. He chose to have it 50 feet next door at the OHSU. So unfortunately, there wasn't any, I didn't know he was there in the first place, but there wasn't anything I could do to help him, and he ended up having an extremely difficult time getting back home to Grant County. And he was rather upset about that, and he shared how his frustrations, and I completely understand that, because here our culture is we do what we can to help the folks who need a trip. So on our out-of-town trips, we take those folks directly to their facilities where their appointments are. We pick them up from their facilities. We don't take them shopping, but we connect them with folks who can take them shopping, or the local transportation that can take them shopping. So although we go through a lot of towns, we don't just dump and run. So I was very disappointed that this gentleman couldn't take the VA van that runs between Portland and Bend 5 days a week. He was denied that trip, and he was very disappointed as well. So that's one of the challenges. We get a lot of calls from veterans who are needing to get to the Portland facility, and we just can't do it. We do have the ability and do go into Boise. We're only able to do that once a month, though, with a reservation, and I need some notice on that because it's not a regular scheduled trip. So we have folks that live out in Monument. It's another rural area of our community that all it takes is reservation, and we take them where they need to go. So I would just encourage the powers that be, when you're thinking about funding, well, it's a $50,000 grant, and that, while that's an awesome thing for us, funding is limited, and there are things that we can't do with that. So, but the folks who are considering applying for this grant or getting started in it, I encourage you to work with your counterparts in other jurisdictions to make sure that if you're traveling somewhere and you're going through a different county, they have a veteran that isn't being served, work with that county to find a way to get those folks on that bus or in that vehicle for free. We should do everything we can. So that is all I had.
Great. Thank you so much, Angie. So we have our 4 speakers are pretty well spread across the entire process, from running the bus itself to the grant program at a higher level. And I'd encourage people to go to their chat box and ask any questions that have come up about getting ready to apply for a grant, about veterans and outreach to them, whatever you're interested in. Before we dive directly into questions, I think my Executive Director, Robin Phillips, would like to say a few words. Robin?
Hi, can you hear me?
You're good.
Okay. Thanks, everybody. I mean, I'm just really, this has been really exciting because I worked directly with Angie and Joni on helping get the veterans in the highly rural counties access to the grants in 2014. And what I think is it's just really a very imaginative group of people that could imagine making all these services happen when, as many of you who are in the audience know, it's really a long way anywhere. And so I really want to thank the people here for giving us that soup to nuts version, and encourage people to ask
Robin,
questions. I mean, Angie.
We just have a lot of background noise, so if anyone's unmuted, please mute your mic while Robin's talking. Go ahead.
That like Angie had to start a new route, and she coordinated with the transit services, not just north of her in Walla Walla, to get free passes for her passengers, but also as she talked about Baker City, and then when she wasn't able to do the trips all the way to Boise, I think, Angie, didn't you work with Angela, Angie Lamborn in Harney County?
Yeah, if there's a trip that we haven't been able to do, we've tried to coordinate with other transportation agencies to get it done.
Great. So it looks like we do have a question. Can a recognized organization apply for and receive the grant and then contract out with an existing transportation system? Darren? Okay, we may have lost Darren for a moment, so I'm going to move on and we'll revisit it if we can get him back. Angie, can you explain just one more time why that individual was denied the ride after their surgery?
Okay, so what he's shared with me is that because he had the surgery at the OSHU hospital, which is on the same campus but a separate entity, instead of the VA hospital there in Portland, they denied that he have a simple van ride from, and he was willing to cross that sky bridge 50 feet, you know, to get onto their vehicle. But they denied it because he didn't have the procedure done at the VA hospital itself. He chose next door.
Right. I think Darren raised that in his presentation, that the money that they are working with is focused on people who are going to VA medical centers, even though co-located with the Oregon Health Sciences, and that they go to other places if, because we have now a new legislation that says, okay, if you're so far away, you can have you can go to a closer medical center, so that non-VA VA services are provided to veterans. So medical services are being provided by non-VA entities to veterans, and I think that he was saying that the veterans transportation money was there to support those trips. So if your veteran had the choice of either using the VA services or was insured privately or under the Oregon Health plan, that then he would be able to choose which hospital did the surgery. But I think it's too bad. We have to think about the fact was he was a veteran and he did need transportation, and it was too bad that there was not the ability for people to figure out how to make that happen.
This is Darren. I'm back. I actually got cut off. A couple of things that are actually not on the slides. There's a program called the Veterans Transportation Service. VA actually provides transportation as well. So I'm not sure why that veteran wasn't routed through the Veterans Transportation Service, but VA and probably 90 medical centers across the country, they have a program called the Veterans Transportation Service. It's unrelated to the grant program, but it's just a transportation service where veterans are transported to and from medical care by VA. Of course, there's a certain catchment area, but that's a resource for folks out there as well. It's not a grant program. It's a VA-owned program. So if you're trying to connect up veterans with transportation at the local medical center, I would look for the mobility manager at the VA in the Veterans Transportation Service. So you can call that VA if you're just trying to get a connection as well. So I wanted to make that point.
Perfect. And Darren, could you clarify, returning to the question I asked earlier, can an organization apply for and receive the Veterans Highly Rural Grant and then contract with an existing transportation organization?
Again, you have to look at to answer that question, you have to look at the eligible entities. So the eligible entities are veteran service organizations. The typical organizations are VAV, American Legion, VFW. Those are the typical organizations as a primary recipient. Now, the primary recipient can sub-grant or sub-award out to another agency or another transportation organization. They can do that, and they can be a sub-recipient. But organizations, the only eligible entities that can apply for the grant itself are veteran service organizations, the ones I mentioned, or state entities like the Oregon Department of Veterans Affairs.
Great. Thank you, Darren. I'd like to ask kind of an open question to our presenters. When reaching out to veterans to either kind of market the services or do travel training, is there anything in particular that worked really well, that worked better with veterans than with other audiences?
I'd like to answer that question, Dave with Oregon. If you look at the first slide that Angie had up today, it was actually her brochure that she had prepared and then made certain that it was made available to any number of groups. Angie, please weigh in on all 10 counties.
Dave, I'm sorry, I think we lost you there. Again, if you're not talking, please mute your mic. Dave, could you say that one more time for us?
Yes. Can you read me?
You're good.
All right. So we placed a tremendous emphasis initially in starting this grant on promotion and advertising. That included making up brochures like the one that you see here that Angie has prepared, contacting local television and radio. Radio has been very effective for us. Contacting all veteran service organizations, as Darren had mentioned, whether they're involved in our program or not, but DAV, MOPH, Marine Corps League, right on down the line, and actually making presentations to their membership. And then after that, truly word of mouth is where a lot of our writers now come from. But each county maintains some type of promotion and advertising program, and they have brochures that are available, and the public is made aware. So that is a lot of emphasis initially, as I said, on promotion and advertising.
Absolutely. Thank you, Dave. So we've run for about an hour right now. I'd like to let the call sit for a minute. If anyone has a last question, we'll take one or two more questions, and then we will thank our presenters and go on with our days. Does anyone else have a question they'd like to submit right now? Okay, so it looks like there aren't any more questions. Do any of the speakers have a closing remark? Or if not, I'll end the call.
This is Darren. I'm not sure if this question was answered. It was in the chat box. It was about Iowa. I think it was about Iowa. Iowa is not a highly rural. Iowa is not a highly rural state, so I wanted to make that clear. I just looked at the listing. So Iowa is not one of those states that have highly rural areas.
Right, and
they would have the Veterans Transit. So there's other programs, the Veterans. One of the things about this is that it sounds like, Darren, that you have other Veterans transportation programs that people in not highly rural areas might not know about, but could use when they're trying to help veterans get rides. Like, how would they, if she was interested in helping her vets, could she find out more about the highly rural veterans or the Veterans Transportation Service?
Yes. So if you go on the website, when you look at the highly rural transportation grant, you'll actually see a Veterans Transportation Service on the side as well. So you can look at that information and actually list the medical centers that have Veterans Transportation Service on there as well. A lot of the Veterans Transportation Service programs actually partner with DAV as well at the VA. So that informational resource will be there as well. The mobility manager at the VA medical center is going to be your key to transporting veterans, along with the social worker. So if you may hear stuff from veterans, but if you don't call the social worker and find out, because the social worker is actually doing the discharge plan. I'm a social worker myself, and that's what we do all day is help veterans get transportation or help people get discharged from hospitals. So if you're not talking to the social worker or the mobility manager, then that's almost a disservice as well for that particular veteran. So that connection should be there. If not, I would at least, try to involve yourself with contact the mobility manager, and that's the start of making that connection and finding out other resources for veterans from the VA perspective.
Great, thanks, Darren. Again, I'd like to thank each of our speakers for volunteering their time and their experience and making themselves available. If you have any questions, the contact information for myself and Robin Phillips is on the screen now, and you feel free to reach out to us at any point if you have a question. Or with feedback, there will be a survey that will go out to everyone tomorrow about this call. And if you'd like to suggest another topic for a future webinar, please do so by emailing the info@nationalrtap.org email address, and we'd be happy to at least look at setting up a call on other topics that are of interest. So thank you, everyone, and have a nice day, have a nice weekend.
Thank you.